Hello, my name is Ramona. I'm a third-year medical student at MUV. I'm Bulgarian who was born and raised in Chicago, Illinois. I've always wanted to study medicine due to its intriguing complexity and how every single disease is similar but different based on the patients. I have spent my whole life translating from Bulgarian to English and vice versa. One of my passions is teaching my colleagues about Bulgarian traditions, culture, and history. Speaking of colleagues, I have a few to introduce to you today from Group 18, which have brought presentations on medical topics to spread awareness. Sarah Lenoy is a 20-year-old girl from Kent, England, which chooses medicine to be able to help people using scientific knowledge. She has been interested in the human body and how it works so intelligently, and how disbalance in one of our systems causes diseases. Sarah's topic today is about COPD, which she chooses due to personal experience. She has told us that she has asthma since a child, which has affected her whole life. Today, she'll be telling us about how nutrition, diagnosis, treatment can help a patient get substantially better or worse.
Hello, my name is Sarah and my presentation is on chronic obstructive pulmonary disease and how nutrition can help it or relate to it. So the table of contents for my presentation include a small introduction, the correlation between COPD and nutrition, prevention, how nutrition can make COPD worse, treatments, and any impacts like socioeconomic impacts and environmental impacts, as well as innovative approaches and future directions in research. So, an introduction, what is COPD? COPD stands for chronic obstructive pulmonary disease. It is a long-term progressive lung disease that makes patients difficult to breathe. There are two types of COPD. Chronic bronchitis, which involves long-term inflammation of the bronchial tubes, which are the airways, leading to mucus buildup, coughing, and difficulty breathing. The second type of COPD includes emphysema. This damages the tiny alveoli, which is the tiny air sacs responsible for gas exchange in the lungs, causing them to lose their elasticity. This leads to trapped air and makes exhaling really difficult. According to the World Health Organization, in 2019, there were 3.23 million deaths worldwide due to COPD. The symptoms of COPD include shortness of breath, especially during physical activities, chronic cough with mucus or sputum, wheezing, fatigue, frequent respiratory infections, chest tightness, bluish lips or fingernails, which is called cyanosis in severe cases, barrel chest, use of accessory muscles for breathing, tachypnea, clubbing, which is basically the enlarged fingertips and fingernails, weight loss and malnutrition. The risk factors that can lead to COPD include smoking, exposure to air pollutants, genetics, age, and a history of respiratory infection. The treatments include medications that will help the patient to breathe better, that include bronchodilators, inhaled corticosteroids, sometimes antibiotics, pulmonary rehabilitation oxygen therapy, lifestyle changes that can be due to the risk factors, and surgery in advanced cases. Now, how does COPD relate to nutrition? It can be looked at three different categories. So number one, the role of macronutrients in lung health. First of all, proteins are vital for building and maintaining respiratory muscles, and carbohydrates, while they provide their energy, they also produce carbon dioxide as a byproduct of their metabolism. So for COPD patients, excessive carbohydrates intake can increase carbon dioxide levels, which can strain the lungs. Fats, they reduce the respiratory load and allows the lungs to work more efficiently. Healthy fats like those from avocados, nuts, and fish are recommended for lung health. Now, the role of micronutrients in immunity and repair. Vitamin C is helping for reducing lung inflammation, vitamin D to reduce the risk of respiratory infections, and vitamin E to protect lung tissues from damage. Minerals like magnesium and zinc also improve airflow and help lung function further. Now, concerns with weight loss and malnutrition. Weight loss causes muscle wasting that can lead to muscle weakness, a decreased immunity, lower exercise capacity, and poor prognosis. To prevent COPD with nutrition, there can be 4 different perspectives. So one with an anti-inflammatory diet, a second one being the Mediterranean diet, number 3 being omega-3 fatty acids, and 4 being hydration. If we're to look in the anti-inflammatory diet, we can first look at the antioxidants. Fruits and vegetables, they are linked to better lung function, reduced COPD incidence, and lower mortality. Oxidative stress and inflammation are key contributors to lung damage in COPD. They are often exacerbated by smoking, pollution, and also obesity. COPD patients show higher oxidative damage and lower antioxidant defenses. So different dietary strategies can help these patients. For example, whole grains that help regulate blood sugar and reduce systemic inflammation. Healthy fats like omega-3 fatty acids that you can gain from fish, flax seeds, and walnuts possess anti-inflammatory properties. Different vitamins also play a role. Vitamin C and E neutralize these free radicals and reduce oxidative stress. Vitamin D modulates the immune response and reduces the inflammation in the lungs. A helps the integrity of the respiratory epithelial cells. Carotenoids, polyphenols, flavonoids, anthocyanins, and curcumin help prevent COPD by reducing the oxidative stress and inflammation in the lungs. Minerals also play a similar role. Micronutrient deficiencies in calcium, magnesium, and selenium are common in COPD patients, especially older and underweight individuals. Higher intakes of these minerals, along with phosphorus, iron, and potassium, support lung function and reduce the COPD risk. Key food sources include dairy, leafy greens, nuts, seeds, seafood, meat, lentils, and fruits. Supplements can also be added and should be added to diet under medical supervision as well. The Mediterranean diet. This offers potential benefits for lung health and COPD prevention due to its focus on whole foods with anti-inflammatory and antioxidant properties. So the key components include olive oil, monounsaturated fats, which reduce the systemic inflammation and supports cardiovascular health, antioxidants that include polyphenols that reduce oxidative stress and improve respiratory function, fatty fish that include omega-3 fatty acids, decreasing air inflammation and mucus production, making breathing easier. Fruits, vegetables, and legumes, they have vitamins and antioxidants as well as phytonutrients, which both combat oxidative stress and anti-inflammatory benefits, while fiber also promotes gut health and reduces the inflammation in the lungs. Omega-3 fatty acids. They are found in fatty fish and have anti-inflammatory properties that benefit COPD patients from producing anti-inflammatory metabolites and reduce inflammation. So when I was doing a research study, there were 3 conclusions that came. One being some studies suggest that a higher omega-3 polyunsaturated fatty acid intake improves respiratory function and reduces COPD risk, though results can be mixed. Another conclusion was that increased omega-6 polyunsaturated fatty acid intake is linked to worsened lung function and higher COPD risk. However, omega-3 fatty acids supplements may improve muscle mass and functional capacity in COPD that show minimal impact on lung function. Omega-3 fatty acids help COPD patients by reducing airway inflammation, improving lung function, and decreasing the mucus production, so overall improving lung function. Hydration is another important point that should be taken into consideration with patients with COPD. Staying properly hydrated is essential for maintaining clear airways and reducing mucus buildup, which can worsen breathing difficulties in COPD patients. Water helps thin the mucus, making it easier to expel from the lungs. So aim for at least 6 to 8 glasses of water daily to keep airways hydrated and promote good lung function. Hydration can also be gained from certain hydrating foods like cucumbers and melons as well. Treatment with nutrition. So overall, to treat COPD patients, these treatments can be taken into account. Macronutrient intake for energy, protein for muscle maintenance and respiratory function, vitamins, minerals, supplements, and high-calorie, nutrient-dense diet. What to avoid when you are a COPD patient? Processed foods and trans fats. They are said to increase inflammation and oxidative stress that can worsen respiratory symptoms and lung function. Obesity and COPD, excess weight restricts lung expansion, so it strains the lung, increases the symptoms, and raises the risk of comorbidities. Malnutrition and muscle wasting. COPD can lead to malnutrition and muscle loss that can further impair lung function. Harmful dietary choices that include fatty, fried food, high-salt snacks, and processed meats increase inflammation and strain the respiratory system further. Cruciferous vegetables may also cause digestive issues in sensitive COPD patients that can lead to bloating. If we were to look at the socio-economic impact, COPD is a major cause of death globally, especially in lower and middle income countries, due to the limited healthcare and higher pollution that causes COPD. Economic costs. COPD results in a high healthcare expense and lost productivity, costing Europe 50 billion euros and the US over $49 billion annually. Food security. Well, malnutrition worsens COPD, with food insecure regions facing a higher risk of infections and a weakened respiratory health. Socioeconomic disparities. Lower income populations face increased COPD risk from poor air quality, smoking, and limited access to care. Climate change and environmental factors can also play a role in COPD patients. The air quality. Poor air qualities that includes pollutants worsen COPD by increasing oxidative stress, inflammation, and flare-ups. Climate change and food systems. Climate change can disrupt the food systems, reducing the access to fresh, nutrient-rich foods needed for COPD patients. The nutritional strategies include promoting sustainable food practices and improving the distribution system to ensure COPD patients maintain access to healthy, affordable diets despite the environmental challenges. Innovative approaches and practical tips given to COPD patients include smaller frequent meals, carbohydrate management, hydration, avoiding foods that cause bloating, protein intake, exercise, and monitoring weight. Future directions in COPD, according to research, are personalized nutrition for certain patients, anti-inflammatory nutrients being implemented more into the diet, nutritional supplements, gut-lung axis, pulmonary rehabilitation, and having a look at how environmental impact can be a major contributor to COPD, and looking forward to studies and research to change these causes. So these are my resources, and thank you for listening.